Now coming to the cap stage. We have already completed with the bud stage. Cap stage. Cap stage. All the stages have their shape in the name itself. The cells undergo uniform proliferation or unequal proliferation in cap stage? Unequal proliferation. Due to unequal proliferation of the cells, there is formation of a cap-shaped enamel organ. Here we can see a cap-shaped enamel organ. Now, in bud stage, there were only two stages present. In cap stage, there will be inner enamel epithelium, outer enamel epithelium, and stellate reticulum. So, the cells present in the convexity of the enamel organ will be cuboidal in shape. Here you can see cuboidal cells present at the convexity of the cap. These cuboidal cells are outer enamel epithelium. The cells in the concavity of the enamel organ will be tall columnar in shape. And these cells will be considered as inner enamel epithelium. Inner enamel epithelium. Now the central cells. Central cells are polyhedral in shape. They synthesize what? Glycosaminoglycans. So, polyhedral cells synthesize glycosaminoglycans. Glycosaminoglycans. These glycosaminoglycans are hydrophilic. Hydrophilic meaning water loving. Hydrophilic meaning water loving. Hydrophilic. So it will absorb water from the underlying ectomesenchyme. From ectomesenchyme. Absorb water from the ectomesenchyme. As a result of which the cells, polyhedral cells, start moving away from each other. Cells start moving away. They then try to remain connected by forming a star-shaped network. Remain connected by star-shaped network. These cells are stellate reticulum cells. Reticulum cells. So here this polyhedral cells then transform into star-shaped network. Here you can see star-shaped cells present in place of polyhedral cells. They contain mucoid material rich in albumin, which acts as a shock absorber. It provides cushion-like consistency and helps in formation of enamel, protects the inner enamel epithelial cells. Rich in albumin. Rich in albumin. So, it provides function of stellate reticulum cells. Cushion like consistency. Provides cushion like consistency and acts as a shock absorber. Absorber and protects the underlying inner enamel epithelial cells. In this diagram, we can see here, this is outer enamel epithelium, this is inner enamel epithelium, and this is stellate reticulum. Star-shaped cells you can see, these are stellate reticulum. And the area of condensation just adjacent to the enamel organ is dental papilla. This is dental papilla. And this portion is dental sac. Now, some transient structures are also present in the cap stage. Transient means temporary, they disappear before enamel formation. Transient structures. Transient structures in cap stage. Which are the transient structures? Enamel knot. Enamel knot. It is a knob-like extension and cluster of the cells present near the inner enamel epithelium. They extend towards the dental papilla. Knob-like extension towards dental papilla. Knob-like extension towards dental papilla of cluster of cells near inner enamel epithelium. Okay. So, which are the transient structures? First is enamel knot. So, if this is our enamel organ, enamel knot will be present near inner enamel epithelial cells forming knob-like extensions. This is enamel knot. Second is enamel cord. Enamel cord. Vertical extension of enamel knot is enamel cord. Vertical extension towards the outer enamel epithelium. Vertical extension towards outer enamel epithelium. Vertical extension of enamel knot towards the outer enamel epithelium. So here this extension is enamel cord. Enamel cord. Next is enamel septum. The point at which the enamel cord meets the outer enamel epithelium is enamel septum. Point at which enamel cord meets outer enamel epithelium is enamel septum. Here, this point will be enamel septum. Last one is enamel navel. Navel. Enamel navel is a depression present at the junction of enamel cord and enamel outer enamel epithelium. Depression at the junction of cord and outer enamel epithelium. So this is enamel navel. Now we also have enamel niche. It is mainly an artifactual defect due to change in plane of orientation during histological preparation. Due to plane of orientation. Enamel niche. So we have completed with the bud stage and now cap stage. Which are the transient structures of the cap stage? Enamel cord, enamel knot, enamel septum and enamel navel. Functions of enamel knot and enamel cord are they act as a storehouse of the dividing cells and act as a reservoir and provide signaling towards the ectomesenchyme. We have already discussed dental papilla and dental sac. Dental papilla, again, condensation of the cells just adjacent to the enamel organ is dental papilla. And the condensation of the cells surrounding both enamel organ as well as the dental papilla is dental sac. Coming to the next stage, which is Bell stage. Bell stage has two divisions. What are the two divisions? Early Bell stage and advanced Bell stage. Bell stage. During Bell stage, shape of the crown is determined. Is determine. Here we can see there is degeneration of dental lamina. We don't have any dental lamina present in the well stage. While in case of bud stage, here we can see attachment with the overlying ectodermal portion. This is the ectodermal portion. But in case of bell stage, there is no dental lamina. So, degeneration of dental lamina takes place during the bell stage. Degeneration of dental lamina. Degeneration of dental lamina. Now, four stages were present in the capsule: inner enamel epithelium, outer enamel epithelium, and stellate reticulum. Only three. But in case of bell stage, four layers will be present. One more layer will be stratum intermedium, which will be present between the inner enamel epithelium and the stellate reticulum. So the cells present, cuboidal cells surrounding the periphery, are outer enamel epithelium, columnar cells near the basement membrane are inner enamel epithelium, flattened cells above the inner enamel epithelium, flattened cells above the inner enamel epithelium. Here you can see the flattened cells. This layer is stratum intermedium. Stratum intermedium. And just above the stratum intermedium are stellate reticulum cells. Stellate reticulum cells. Stellate reticulum cells. So in case of bell stage, there are inner enamel epithelium, outer enamel epithelium, stratum intermedium, and stellate reticulum. We know the functions of the other cells. Inner enamel epithelium is involved in formation of the enamel. Stratum intermedium. Stratum intermedium is a flattened cell layer just above the inner enamel epithelium. Stratum intermedium. Stratum intermedium. Stratum intermedium synthesize proteins. Stratum intermedium synthesize proteins, provide nourishment to the inner enamel epithelium, provide nutrition to inner enamel epithelium, have high activity of alkaline phosphatase, expresses high activity of alkaline phosphatase. Increased activity of alkaline phosphatase. Increased activity of alkaline phosphatase. So major function is providing nourishment to the inner enamel epithelial, that are pre-amyloblast cells, for the formation of the enamel. This can also be an MCQ question. It expresses activity of alkaline phosphatase. And degeneration of dental lamina begins during the Bell stage. Inner enamel epithelium cells are tall columnar cells, which are pre-amyloblast cells, pre-amyloblast cells. The nucleus is towards the basement membrane. Nucleus near basement membrane. Histo differentiation of cell starts. They influence the underlying outermost layer of the dental papilla cells to differentiate into odontoblast cells. Influence dental papilla cells to differentiate into which cells? Odontoblast cells. Odontoblast cells. This you will have to remember. Inner enamel epithelial cells, that are pre-amyloblast cells, are tall columnar cells. They have nucleus towards the basement membrane, and they will influence the underlying ectomesenchymal cells just adjacent to the enamel organ. What is this portion called? Dental papilla. So the outermost layer of the dental papilla cells will receive signal from the pre-amyloblast cells, and they begin their differentiation into which cells? Odontoblast cells. Now, we have a basement membrane separating the pre-amyloblast and the odontoblast cells. Basement membrane separating inner enamel epithelium and odontoblast cells is known as membrana preformativa. Membrana preformativa. Membrana preformativa. Basement membrane separating the inner enamel epithelium and the odontoblast cells is known as membrana preformativa in Bell stage. Now coming to the cervical loop. Cervical loop. Cervical loop is the terminal portion of the enamel organ where only inner enamel epithelium and outer enamel epithelium will be present. Consists of inner enamel epithelium and outer enamel epithelium. Terminal portion of enamel organ. Here you can see diagram of a advanced Bell stage. So this layer is outer enamel epithelium. This flattened columnar cells you see are inner enamel epithelium. Flattened cell layer just above the inner enamel epithelium is stratum intermedium. And between the stratum intermedium and outer enamel epithelium are our stellate reticulum cells. This stratum intermedium layer you can see in this diagram, the flattened cell layer. The inner enamel epithelium influence the underlying dental papilla cells and they differentiate into odontoblast cells. These cells are odontoblast cells. Under the influence of inner enamel epithelium, they differentiate into odontoblast cells. And this terminal portion where only inner enamel epithelium and outer enamel epithelium is present is cervical loop. Initially, the inner enamel epithelium is receiving nutrition from the dental papilla during the early Bell stage.